Okay, so most people who have been dealing with a stubborn disc or nerve issue are really feeling kind of lost and feeling some sense of hopelessness. And the question really starts to come forward: how do I know where to start? How do I know where to even begin to start moving past this and getting my life back? And so I'm going to share that with you. I use a very simple framework. It's called the 4 phases of a complete recovery. Um, and I think understanding more about this framework is going to help you understand where you're at, but then you also want to draw from this a vision of where you want to go. Because without that vision, the path can be very muddy, it can be very unclear, and we want a very clear path to your complete recovery. Okay, so the 4 phases of a complete recovery. I'm going to kind of rifle through these. You can come back and watch again if you need to. So the first phase is acute. The pain or limitation dominates. The focus tends to be on relief versus performance. So what I mean by that is folks in this phase, and this may be you, are really just, how do I get some relief from these symptoms? How do I find some way to relieve these symptoms? And in this phase, that seems good enough, but the reality is it's not. And we'll talk about that. The other thing that is very present in this phase is what we call the price of pain. And so the price of pain, and it may be the symptoms that are causing this pain for you, but the price of pain has to do with that the symptoms are not all there is. It's how these symptoms affect all these other areas of your life. And the 4 most common areas are your health, your ability to stay healthy, feel healthy, your wealth. How much are you spending on treatments that aren't getting you where you want to go? How much are you losing out on work? How much are you missing out on the ability to get promoted or even to do the training you need in order to move forward? Relationships. It's really hard to tune into people when you're hurting, and people read that. And then it feels really hard because you feel like you're letting people down. It may not be you, but I hear this a lot. People start to feel more isolated and begin to isolate themselves because they don't want to deal with the possibility of getting in pain or the possibility of spoiling other people's plans, or the conversation to be all about you and what you're dealing with. The other thing then, of course, it shows up as feelings. And there can be any number of ways that a person reacts to this acute, pressing, negative symptoms. It can be sadness, it can be anger, it can be just frustration, hopelessness can also show up. So that's the acute phase. Critical phase. Not good, but not terrible either. So you have this relief from the pain or the major symptom, but it might still be periodic. And at that stage, most therapies kind of leave you to your own devices. They say, take it easy, go slow. Don't do that anymore, right? Which to me is like, that's not rehabilitation. That's just telling me not to do what I like to do, because that may be how you ended up getting hurt in the first place. But there's a tendency to dip back into the acute phase and drift out of it again repeatedly. I say it's like a stone skipping on the surface of pain. No true capacity or confidence. There's negative thoughts of what next, or just this sort of simmering fear in the back of your brain that if I do the wrong thing, I'm going to pay. Okay, that's the critical phase. The next phase is what's called functional. Now, when you get to functional, you start to feel a renewed sense of freedom and maybe a small sense of exploration. You might start thinking about taking on new tasks or picking up a new project, or taking that training that you were waiting to take to move your career forward. You will probably start to have positive thoughts of what's next, right? What's next for me? I'm kind of excited about this. Less fear, more confidence, and a real internal sense of relief, as opposed to just getting relief from the pain or symptom, but a genuine lightening of the load internally. And then the last one is specialized. So the specialized phase, people will feel a sense of challenge. They'll feel a large sense of exploration. It says exploration. That was an autocorrect. It's an auto mess up. A large sense of exploration, right? Like wanting to explore what this body is capable of, wanting to explore my world, wanting to take that trip that I hadn't decided to take. There's a drive to kind of find the edges of capacity or experience. So somebody might decide to go hike a mountain or navigate a river on a kayak or travel to some ancient place where you have to like climb and get around over challenging terrain, whatever that might be. There's also a sense of there's no stopping me. Like I am ready to take this bite and chew on it and have a great time with it. So those are the 4 phases. For you, the job that I would propose to you is to figure out what phase are you in and where do you want to go? Which phase would you like to see yourself in? 2 very important things to get clear about.